Hello everyone, I'm Dr. Santoshi Nandigam, consultant obstetrician and a gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel, and today I'm going to discuss about what can you do to prevent a miscarriage. The most common reason anyone can miscarry is something wrong with the genetic composition of the baby. 1 in 4 pregnancies end up in a miscarriage, and the most common reason is going to be some abnormality in the formation of the baby. I can say with full confidence that you cannot control it. Sometimes it just happens and you need to accept it. But there are certain things which you can definitely have a control on. Number 1, smoking causes cancer. Smoking also causes miscarriage. So if you are a chronic smoker or a social smoker or a binge smoker, this is your sign to stop smoking, especially when you're planning pregnancy or when you're pregnant. Passive smoking is also harmful. So I would suggest pregnant mothers or mommy-to-be's or mothers who are trying to conceive to actually not be around people who smoke. The second is alcohol. Alcohol, I know it gives you all that high, it makes you happy, it gives that false sense of pleasure and all of that, but it's definitely not your best friend when it comes to plan a pregnancy or when you're pregnant. So alcohol causes fetal alcohol syndrome, where the baby has lots of congenital malformations, physical abnormalities, developmental abnormalities in the organs, and that's not what you want to give to your baby. Number 3, medications that you are on or that you're taking for some kind of chronic conditions. Most young women are very, very sensitive about the way they look. Especially the adolescents, there is a lot of incidence in acne, the PCOS, hormonal disturbances, increased testosterone, and they resort to going to doctors to reduce their acne or any kind of skin symptoms. So the medications that you are on or that you used for acne, especially the tretinoin or the isotretinoin, are actually really harmful if you are planning to get pregnant in the future or in the next couple of months. So when you are on any chronic medication for any chronic condition, be it acne or fits or epilepsy, it's always better to go give the information to your gynecologist. Let them see the medications that you've been taking, because certain medications do cause miscarriages, and that also includes certain type of antibiotics. So do not be your own doctor. Do not start taking medications on your own when you're pregnant. Do not treat yourself or treat your cold or cough or fever with any antibiotic on your own without any information from your gynecologist. The fourth one is nutrition. I cannot emphasize more on having a healthy, balanced diet. And there is a lot of misconception or myths about the foods that you can eat while you're pregnant. So eating a pineapple or eating papaya causes miscarriage. Well, this is the funniest myth that we gynecologists actually hear. Eating a papaya does not cause a miscarriage. An unripe papaya has an enzyme called as papain and bromelain, which has a tendency to cause uterine cramps. Similar to a pineapple, eating a small bowl of a ripe papaya or a ripe pineapple is actually not going to cause any miscarriage. Well, coming to the point, eating a healthy, balanced diet. Your plate should include good quantity of proteins, fats, carbohydrates, not to leave out the fiber, vitamins and micronutrients, including sodium, potassium, zinc, calcium, everything in a balanced mode. Folic acid. It's a quintessential vitamin which is needed for a healthy pregnancy. Folic acid is required for the formation of the genetic material of the baby. It is also required for the development of the brain and the neural tube. Neural tube is the future spine of the baby, and any deficiency in folic acid results in abnormalities in the formation of this neural tube. So these abnormalities can manifest as a small swelling in the back of the baby at birth to a literally open spinal cord, where you can actually see the nerves of the spinal cord, called as the spina bifida defects. So folic acid forms a really important nutrient which is required to prevent any miscarriages or fetal malformation, especially associated with the brain and the spinal cord. Fifth is attending to regular master health checks. So I see really young women in their mid-20s or early 30s coming with blood reports showing uncontrolled diabetes or uncontrolled hypertension or uncontrolled thyroid. So why is this happening? There is a general increase in the incidence of all these chronic medical conditions, including diabetes, hypertension, and thyroid. And the only way that you can know whether your bloods are appropriate, or whether your sugars are normal, or whether your hormones are normal, or your thyroid is normal, is by attending to regular master health checks. So my recommendation would be having a regular blood check for your thyroid, sugar, lipids every now and then, which can be either 6 to 8 months, or if that's not workable, at least a year. Because uncontrolled medical conditions have a potency to cause miscarriages, and that's something which we can definitely prevent.